Hoy estamos conversando sobre los diagnósticos en español y vamos a empezar. Siempre empezamos con vocabulario, un poquito de vocabulario al azar, some random vocabulario about diagnósticos. So first of all, los resultados, the results. Sus niveles de blank, whatever it might be, están altos, are high, están bajos, are low, normales or anormales, normal or abnormal. So niveles is your word for levels. So sus niveles de whatever it might be, están altos, están bajos, normales o anormales. Bien, esto significa que this means that you finish the sentence. No sabemos exactamente por qué. We don't know exactly why. Usted tiene, just simple diagnosis. You have. Usted padece de, another verb that typically is used for more chronic conditions. Usted padece de, which is very similar, synonymous to usted sufre de, you suffer from. Different, you probably don't use these when you're talking about the flu or strep throat or something like that that's a little more acute. Rather, you would use these for something more chronic. Okay? Hay varias opciones de tratamiento que podemos considerar. There are various treatment options that we can consider. Los pros y los contras, the pros and cons, the benefits, disadvantages, etc. Los pros y los contras. Los beneficios y los riesgos, if you prefer to speak about benefits and risks, ¿verdad? A corto plazo, in the short term. A largo plazo, in the long run or in the long term. Tratamientos, treatments. Aliviar los síntomas, alleviate the symptoms. Curar la condición, cure the condition. Mejorar la condición, improve the condition. And then finally, tratar la condición. Tratar, treat the condition. Okay, let's look at diagnósticos sencillos, things that you could do that have, very little risk involved and they're just day-to-day, you have a virus type of thing. Okay, diagnósticos sencillos, communicating diagnósticos sencillos. Usted tiene blank, whatever it might be, a streptococo de garganta, strep throat. Or something like los resultados indican que usted tiene streptococo, okay? The results indicate that you have strep throat. Usted necesita, whatever the plan de tratamiento, usted necesita tomar antibióticos. That's our plan de tratamiento, for example. Or maybe you speak in the we voice. Nosotros necesitamos whatever the plan de tratamiento might be. Okay. Moving on to something un poquito más complicados. That's pretty simple, right? Now, un poquito más complicados, maybe a little less certain. Now, first of all, before we dive into this, basically from here and beyond in our little lesson here, you should be taking this note into consideration. When we talk about responsible use of Spanish with patients, that's kind of our goal, right? We're learning Spanish, but we never want to use the language in an irresponsible way, right? So that probably means that unless you're an advanced speaker, you'll likely have an interpreter with you to help talk through if this, then that, those kinds of decisions that patients need to make. Keep that in mind. Okay, poquito más complicado. Parece que usted tiene condición. It seems like you have this. Pero necesitamos hacer unas pruebas más para confirmar. But we need to do some additional tests or some more tests to confirm. Si los resultados indican que tiene one thing, tendremos que, whatever the tratamiento is, right? So if the results show that you have this, then we will this treatment, right? Es probable, subjunctive for you advanced speakers, es probable que sea, that it is probable que tenga, that you have, es probable que esté, that you are, whatever the diagnosis might be, pero necesitamos confirmar con prueba, a test, análisis, some analysis, or some type of imagen, right? Perfecto. Let's give an ejemplo. We had one community member requested some information about neck pain, and so I thought we'd use that as our example. So, un ejemplo, dolor de cuello. Los síntomas que tiene ahora después del accidente, so the symptoms you're having now after the accident, indican que probablemente tiene latigazo cervical. You probably have whiplash. Pero necesitamos descartar, rule out, descartar, good verb for you. Necesitamos descartar otras posibilidades, other possibilities, porque también puede ser, because it could also be un disco herniado, un nervio pinzado, a pinched nerve, or nervio apretado, a couple ways to talk about pinched nerve, o enfermedad degenerativa del disco. Okay, so a few possibilities. Para confirmar exactamente, to confirm exactly lo que está pasando, what's going on, necesitamos hacerle a couple of images here. Rayos X, tomografía, IRM, yes, that's MRI. And we've talked about this in the past, but remember, if all of your patient navigation in your system or your clinic or your hospital that you work in is in English, you're probably not helping your patient at all by using the acronym in Spanish. You should probably just say su MRI or MRI so that they can then hear that, see it on all the navigation visuals within the hospital and know where they're going, right? If you start mixing things up, then you're assuming that they're going to straighten it out as they're trying to navigate wherever they're going and doing what they're doing. Bien, tomografía, CT scan, okay? Yes, tomografía computada is the full word, but most folks just say tomografía. Ok, bien. So, para confirmar lo que está pasando, necesitamos hacerle, we need to do, and this le means do to you, necesitamos hacerle whatever, okay? And then some if-then stuff. Si es un latigazo cervical, vamos a, and whatever the treatment might be for your latigazo cervical. Si es un disco herniado, recomiendo whatever the tratamiento might be. Maybe it's cirugía, etc. Okay? Cortisona, who knows. Si es un disco herniado, recomiendo whatever the tratamiento might be. And you can use that if, and then recomiendo, si, recomiendo, with any kind of combination, right? Okay, perfecto. Moving on to some diagnósticos graves. A little poco más difícil. Remember, yes, you're likely with an interpreter unless you're total approved bilingual, right? Okay, bien. He recibido, or recibí, simple past tense, los resultados que necesitamos hablar sobre próximos pasos. I've received the results and we need to talk about next steps. Otras maneras de empezar. Tengo buenas noticias. I have good news, hopefully. Tengo malas noticias. I have bad news. Esta es una condición complicada. This is a complicated condition. Or esta es una condición agresiva. This is an aggressive condition. Esta es una condición grave, serious, grave. Okay? Bien. Necesitamos tomar unas decisiones difíciles. We need to make some difficult decisions. Notice that in English we say make, which you might think is the verb hacer in Spanish. But with decisions specifically, it's tomar. We don't make decisions in Spanish, we take decisions in Spanish. And so you'll want to undo your hacer decisiones and replace it with tomar decisiones. Necesitamos tomar unas decisiones difíciles. Si le gustaría, if you would like, puedo recomendar otro médico, otra clínica, otro especialista, another specialist, para una segunda opinión, for a second opinion. So what we're doing here is if you would like, conditional, si le gustaría, puedo recomendar, I can recommend otro médico, another doctor, otra clínica, another clinic, otro especialista, another specialist for a second opinion. Okay? Bien. And no sabemos con certeza cómo el cuerpo va a responder a tratamiento. So we're not certain or we're not 100% certain how the body will respond to treatment, whatever it is we're talking about. Pero sabemos que este es el tratamiento recomendado. But we know that this is the recommended treatment. Okay? Bien. Ahora, as I was doing some research, I'm so thankful for so much information online about communication and patient-to-provider communications. But there was a three-step process that I really liked to ensure that patients know what you're talking about. And I'm sure you use variations of this in your own practice. So, 3 pasos sencillos para asegurar buena comunicación. Okay, so los 3 pasos were basically to make sure that el problema principal is clear with your paciente. Secondly, that your patient understands qué hay que hacer. What do they need to do? And tercero, why is it important for your patient? Okay, so bien, let's take a look at each of these rápido. El problema principal. So, discussing the problema principal, describing the condition, etc. Here are a few ideas for you. Es una condición que afecta, whatever. This is a condition that affects, you could put different body parts, you could talk about different functions there, systems within the body, etc. Cuando hay un problema con, when there's a problem with, again, this system, this body part, this organ, it results in, and what are the outcomes? What are the results? It results in reduced this, or more of that, or difficulty with this, or failure there. So you fill in the blank, right? Bien. So they kind of understand what is happening with the illness and what the results are in the body. ¿Qué hay que hacer? Tenemos algunas opciones para tratamiento y cada opción tiene sus pros y contras. So, we have some options for treatment and each option has its pros and cons, ¿verdad? Mi meta, your meta, goal es ayudarle a entender los pros y contras. My goal is to help you understand the pros and cons de cada opción, of each option, para que pueda tomar una decisión, so that you can make a decision. Again, we're using take instead of make. El tratamiento recomendado es, whatever that tratamiento might be. Este tratamiento dura maybe X tiempo, or requires this, that, or the other. Requiere whatever procedure maybe. Lo bueno de esta opción es, here you can talk beneficios. Los contras son, and whatever the efectos adversos, etc. are of the tratamiento. Hay otras opciones también. There are other options also. Los pros y contras de whatever the opción son, and you could just go start listing how they're good and bad, ¿verdad? Perfecto. Moving on to paso 3. ¿Por qué es importante para mí saber esto? And understanding la condición, this is where they were talking about teaching back what they understood, and then leading into whatever questions they may have. So, retroenseñanza. It's kind of like an Anglicism. It's not a super widely known word in Espanol. So don't go throwing around retroenseñanza. It'll take some time to catch on. But it is becoming a word in Spanish, let's say. Teachback. Bien. Hablamos sobre muchos detalles. We've talked about a lot of details. Ahora, now, explíqueme lo que entendió usted del problema. Explain to me what you understood about the problem y las opciones y las decisiones que hay que tomar, and your options and the decisions that you need to make, although it says take. Okay, bien. Normally, mis pacientes tienen muchas preguntas en esta situación. Normally, my patients have a lot of questions in this situation. ¿Cuáles preguntas tiene en este momento? What questions do you have now? Okay, so you've given your patient some time to teach back what they understood about their condition and what options there are for treatments, pros and cons, and that hopefully was a discussion where you were able to interject, correct, improve understanding. Okay, bien. And then concluyendo, in conclusion, concluding, Entiendo que la decisión que necesita tomar no es fácil. I understand that the decisions you need to make are not easy. Tome su tiempo para pensarlo y conversar con su familia. Okay? In the case where it's not urgent and they have time to figure things out, tome su tiempo. Take your time para pensarlo y conversar con su familia and talk with your family. Or in other situations, maybe it is urgent. So, nos urge, it's urgent for us. Nos urge tomar una decisión lo antes posible. It's urgent to make a decision as soon as possible. ¿Cómo le puedo ayudar en ese momento? How can I help you in this momento? Okay, bien. Well, hopefully I have helped you with some possible patterns and structures and phrases that you can use as you're talking about diagnósticos with your pacientes. So for now, muchas gracias. And if you're looking for más oportunidades con el español, visítenos en commongroundinternational.com. Hasta luego, hasta el próximo viernes. Adiós. Hey, thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.